I'm Peter Block here in Chicago at ACC 2016 for On the Scene, and with me is Klaus Witte from Leeds. And Dr. Witte has been very interested in the whole issue of vitamin D, and candidly, when I was talking to him just a few minutes ago, I was scratching my head trying to figure out how vitamin D might help coronary disease, but Dr. Witte is going to tell us about it. So Klaus, tell me about your study.
So the Vindicate was a pragmatic, randomized, double-blind, placebo-controlled trial in patients with chronic heart failure due to left ventricular systolic dysfunction and ejection fraction of less than or equal to 45%. Simple, pragmatic study, broad inclusion and exclusion criteria. Primary endpoint was patient-orientated, 6-minute walk distance, secondary endpoints of safety and efficacy on cardiac function.
Okay, so sort of semi-soft endpoints, no death or myocardial infarction.
Absolutely not yet.
Okay, so how much vitamin D did these folks take?
They were randomized to a chewable, blackcurrant flavored, non-calcium based 100 microgram vitamin D tablet versus matching placebo per day.
All right, so let's get to the bottom line. What'd you find?
We found a quite dramatic improvement in left ventricular ejection fraction and a reduction in left ventricular volumes and dimensions after 12 months of supplementation that was not seen in the patients taking placebo.
Oh, come on, Klaus. Now you're telling me a vitamin supplement is going to take care of people that have left ventricular dysfunction. How does that possibly happen?
Well, Vindicate was not designed as a mechanistic study. We did want to do we will do a mechanistic study. We did want to do a mechanistic study, but of course all the grant-giving bodies would say, first of all, prove that it works, and then you can look at mechanisms. It may well be that there's an improvement in calcium flux in the cardiomyocytes that leads to improved contractility and also improved relaxation, but it's too early to tell for sure what the mechanisms might be. Of course, vitamin D also has effects on body systems, arterial function, renin-angiotensin system function, immune system function, as well as the recognized effects, of course, on skeletal mineralization.
But the good news is that the downside, the bad effects of vitamin D are relatively small.
Yes, we saw no adverse effect on calcium or creatinine levels. We saw no other clinical adverse effects at all, and the tablet was very well tolerated.
Well, I'm not quite sure what to say here, Klaus, but vitamin supplementation for heart failure sounds like an awesome way to take care of some of these folks. I think it's a little early to say everybody should take vitamin D, but stay tuned for this one. Thank you, Klaus.
Thank you.